Part 13. Diagnosis and treatment of gynecological and pediatric diseases. Diagnosis and treatment of gynecological diseases. Menexemia. Menexemia is the change of color, amount, and cycle of menses with other symptoms. It is mainly due to irregularity of the Chong and Ren meridians. Treatment. Take Guanyuan Ren 4 and Sanyanjiao Spleen 6 as the main points to regulate the Chong and Ren meridians. Guanyuan Ren 4 is the move point of the small intestine on the Ren meridian, and Sanyanjiao Spleen 6 the meeting point of the liver, spleen, and kidney meridians. 1. Blood heat type. This patient likes to drink wine and eat spicy foods. The patient has her menses twice a month, excessive in amount, and red in color. She feels restless with a dry mouth, and has a wiry and rapid pulse and a red tongue with a thin yellow coating. Treatment. Besides the main points above, needle the associated points Taichung liver 3 and Taixi kidney 3 to suppress heat and nourish blood. Needle Guanyuan Ren 4 with the even movement method. Twist the needle for half a minute and retain. Insert the needle into Sanyanjiao Spleen 6 at a 15-degree angle with the even movement method. Needle Taixi Kidney 3 with the twisting and reducing method. And needle Taichung Liver 3 with the twisting and reinforcing method. Retain the needle for 20 minutes. 2. Qi deficiency type. Excessive menses of lighter color, arriving prematurely before the normal date, results from overwork and weakness of the spleen and stomach. The patient feels palpitations, dizziness, abdominal distension with poor appetite, and soft stool. Treatment. Needle the associated points Pishu, letter 20, and Zusanli, stomach 36, as well as the main points in the prescription to invigorate spleen and nourish qi. Puncture Pishu, letter 20, and Zusanli, stomach 36, at a 15-degree angle with the reducing method. 3. Cold damp type. A delayed menses of 7 to 8 days with lower abdominal pain occurs when the patient takes too much fruit and cold drinks. The blood has purplish clots and the flow is not smooth. The pulse is deep and the tongue coating is thin, white, and sticky. Treatment. Mingmen, Du 4, Guilai, stomach 29, are needled along with the main points in order to expel cold by warming the meridians. Needle Mingmen, Du 4 with the twisting and reinforcing method for half a minute and take it out. Needle Guilai, stomach 29 at a 15-degree angle. With Moxa stick, apply Moxibustion at Guanyuan, Ren 4, and Guilai, stomach 29. Keep the needles at these points for 20 minutes. 4. Blood deficiency. A thin, scanty, delayed menses occurs due to blood loss and weakness with palpitations, lassitude, and dizziness. The pulse is thready, and the tongue is flabby with a thin coating. Treatment. Needle Ganshu, letter 18, Pishu, letter 20, and Zusanli, stomach 36, with the main points to invigorate the spleen and nourish the blood. With the reinforcing method, insert needles into Ganshu, letter 18, and Pishu, letter 20, and take them out after twisting for half a minute. Then needle Zusanli, and retain for 20 minutes. 5. Qi stagnation of the liver type. The patient has been upset for several years by menstrual disorders. The menses is purplish with clots and the patient has lower abdominal pain, hypochondriac discomfort, and experiences belching. The pulse is wiry and the tongue has a thin white coating. Treatment. Needle the associate points Jianli, Ren 11, Neiguan, pericardium 6, and Taichung, liver 3, together with the main points to disperse and rectify the depressed liver energy. Needle Jianli, Ren 11, at a 15-degree angle. When needling Neiguan, pericardium 6, make the patient experience a downward sensation. Retain the needles at these 2 points for 20 minutes. Needle Taichung, liver 3, with a twisting and reinforcing method, and retain for 20 minutes. 6. Kidney deficiency type. Excessive sexual activities leads to depletion of the kidney and menstrual disorders accompanied by lumbago, tinnitus, excessive leukorrhea, and even infertility. The pulse is deep and weak. The tongue has a thin white coating. Treatment. The needle points are Jiaji, extra point, Shenshu, bladder 23, Diji, spleen 8, and Taishi, kidney 3. They are used together with the main points to invigorate the liver and kidney. Needle Jiaji, extra point, and Shenshu, bladder 23. Do not retain these 2 needles. Needle DG, spleen 8, with the reducing method, and Taishi, kidney 3, with the reinforcing method. The patient should receive the treatment once a day, some 5 to 7 days before the menses comes. At other times, the treatment is given once or twice a week. For the patient with no definite menstrual cycle, the treatment is given once every other day, except during the menstrual period. Pay attention to sanitation during the menses. The patient is prohibited from sexual activities, tub baths, or swimming. Do not eat too much cold or spicy food and fruit. Do not smoke and drink wine. Keep the lower limbs warm and stay cheerful. Dysmenorrhea. Dysmenorrhea means that the woman feels severe pain in the lower abdomen before, during, or after menstruation. 1. Sthenia syndrome. For excess syndromes, the main points needled are Shiqizui, extra point, the extraordinary point for both excess and deficiency types, and Zhongji, Ren 3, which is the meeting point of the Ren and the 3 yin meridians of the foot. Saninjiao, spleen 6, which is the meeting point of the liver, spleen, and kidney meridians. The menses are scanty and purplish. The patient is depressed by the stagnation of qi in the lower buria. She feels a distending pain in the hypochondriac region. The signs are a wiry pulse and a dark tongue with a thin coating. Treatment. For those with stagnation of the qi in blood, Neiguan, pericardium 6, and Zhongwan, Ren 12, are needled to open the chest and regulate the qi. Select Shiqizui, extra point, and needle with the reducing method by thrusting and twisting for 1 minute. Retain the needle and take it out after 10 minutes for Moxibustion. Needle Zhongji, Ren 3. Twist for 1 minute and give the patient a downward sensation. Retain the needle and apply Moxibustion. Needle Neiguan, pericardium 6, and Saninjiao, spleen 6, with a gentle reinforcing and reducing method. Turn the needles intermittently and retain them for 30 to 40 minutes. The patient of the cold and damp type is affected by cold and has had cold drinks during menses, which causes fewer menses with purplish clots. The pulse is deep and the tongue coating is thin, white, and sticky. Treatment: Shui Dao, stomach 28, and DG, spleen 8, are needled as well as the main points to expel cold by warming the meridians. Needle Shui Dao, stomach 28, and supplement with Moxibustion. Needle DG, spleen 8, with a twisting and reinforcing method. Retain for 30 to 45 minutes. A. For excessive type, 3 menstrual cycles constitute a course of the treatment once a day or twice a day. For severe dysmenorrhea, start 2 to 3 days before the menses until the pain is relieved. 2. Asthenia syndrome. Treatment: the main points for deficiency type are Shi Zui, extra point, Guanyuan, Ren 4, and Sanninjiao, spleen 6. Deficiency of qi and blood. The patient feels slight pain in the abdomen due to weakness. The menses are scanty and thin. There is a thready pulse and a pale tongue with a thin coating. Treatment: the associated points are Ganshu, bladder 18, and Pishu, bladder 20. All these points are needled with a twisting and reinforcing method to strengthen qi and blood. Needle Shi Zui, extra point, with a gentle reinforcing and reducing method. Retain the needle for 1 minute. Apply Moxibustion for 10 minutes. Needle Ganshu, bladder 18, Pishu, bladder 20, and Guanyuan, Ren 4, with a twisting and reinforcing method for 1 minute, and retain the needle. Then apply Moxibustion. Needle Sanninjiao, spleen 6, with a gentle reinforcing and reducing method. 2. Deficiency of liver and kidney subtype. The patient feels slight pain in the abdomen before menses comes. This is due to impairment of the Chong and Ren meridians from overfertility and excessive sexual activities, which causes feeble blood circulation. The pulse is deep and thready, and the tongue is pale with a thin and dry coating. Clinically, she has pelvic inflammation and leukorrhea with lumbago tinnitus and dizziness. Treatment: besides the main points of deficiency, needle T9 Jiaji, extra point, Shenshu, bladder 23, and needle the extra points DG, spleen 8, and Taixi, kidney 3, for those with profuse leukorrhea in order to invigorate the liver and kidney. Needle T9 Jiaji, extra point, and Shenshu, bladder 23, with a gentle reinforcing and reducing methods. Needle DG, spleen 8, and Taixi, kidney 3. The patient suffering from dysmenorrhea of Shu deficiency type should receive acupuncture treatment once a day until the pain is relieved, and later twice a week. One course takes 3 months. Magnetic pearl therapy of auricular points is applied together with the acupuncture. During the menstrual period, it is advised to avoid cold, raw, hot, and spicy food. Amenorrhea. Amenorrhea refers to the phenomena of no menses for women above 18 years old, and it also refers to the cessation of menses after at least 3 months of regular cycles. There are 2 types. 1. Amenorrhea due to stagnation of blood. The patient is affected by colds. Raw food intake during menses causes the menses to stop for several months. The patient feels cold with pain in the lower abdomen, the pulse is unstable, and the tongue coating is white and sticky. Treatment. The first prescription includes Zhongji, Ren 3, Hegu, large intestine 4, and Sanninjiao, spleen 6. The second prescription includes Siliao, bladder 32, Guilai, stomach 29, and Xuehai, spleen 10. Use these two prescriptions alternately to disperse cold by warming up the meridians. Needle Zhongji, Ren 3, with a gentle reinforcing and reducing method. Retain the needle. Apply warm Moxibustion with 2 cones of Moxa. Needle Hegu, large intestine 4, and Sanninjiao, spleen 6, at a 15-degree angle. Retain the needles for 20 minutes. The next day, apply the second prescription. Needle Siliao, bladder 32, with the twisting and reducing method for 1 minute. Needle Guilai, stomach 29, with the even movement method, and apply 2 Moxa cones to warm the needle. Needle Xuehai, spleen 10, with the reducing method. Retain the needles for 20 minutes. 2. Stagnation of qi and blood stasis. The patient has hypochondriac and lower abdominal pain and distension. Treatment. Needle Neiguan, pericardium 6, and Taichung, liver 3, in addition to the points of the first prescription mentioned above. Needle Zhongwan, Ren 12, and Xingjian, liver 2, in addition to the points of the second prescription mentioned above, to regulate qi and invigorate blood. Needle Neiguan, pericardium 6, at a 15-degree angle with the even movement method. Needle Taichung, liver 3, with the reducing method. Needle Zhongwan, Ren 12, with the even movement method. And needle Xingjian, liver 2, with the reducing method the following day. 2. Amenorrhea due to severe anemia. Asthenia of the spleen and stomach. The patient has decreased menses with each passing month, until amenorrhea for half a year or more occurs, which is due to overwork and irregular food intake. At the same time, the abdominal distension, poor appetite, and loose stool appear. The pulse is thready, and the tongue is pale and flabby with a sticky white coating. Treatment. The first prescription includes Zhongwan, Ren 12, Guanyuan, Ren 4, and Sanninjiao, spleen 6. The second prescription includes Tianshu, stomach 25, Qihai, Ren 6, and Zusanli, stomach 36. Puncturing the above points with periodic manipulation can invigorate the spleen and nourish the blood. The first prescription, needle Zhongwan, Ren 12, at a 15-degree angle with the even movement method, giving the feeling of a spreading sensation. Needle Guanyuan, Ren 4, with the reinforcing and twisting method until the patient feels a downward sensation. Apply Moxibustion at these 2 points. Needle Sanninjiao, spleen 6, and make the patient feel an upward sensation. Retain the needles for 15 minutes. Apply the second prescription the following day. Needle Tianshu, stomach 25, and Qihai, Ren 6, with the reinforcing and twisting method. The needle is retained and Moxibustion is applied. Needle Zusanli, stomach 36, with the even movement method. All needles in this prescription are retained for 15 minutes. 2. Blood deficiency after the disease. The patient has a pale complexion and feels palpitation and lassitude. The pulse is thready and the tongue is pale with a white coating. Treatment. Needle Jiaji, extra point, Pishu, letter 20, and Shenshu, letter 23, in turn to invigorate the qi and nourish the blood. Needle Jiaji, extra point, Pishu, letter 20, and Shenshu, letter 23, with the reinforcing and twisting method for a half a minute. The treatment is given once a day or every other day. 10 times are one course of the treatment. The second course begins 3 to 5 days later. After the menses, another course of the treatment is needed. It is advised to take digestible food. Avoid raw, cold, sour, and fatty food. Metrorrhagia. Metrorrhagia indicates irregular bleeding without blood stagnation, resulting from the impairment of the Chong and Ren meridians. Metrorrhagia is abnormal uterine bleeding, and the excessive bleeding is called bung collapse, and dripping with blood is called lin, or. This includes excessive irregular vaginal bleeding and excludes organic reproductive system diseases. Clinically, there are 2 types. 1. Metrorrhagia due to qi deficiency. The patient feels tired and dizzy resulting from overwork and has lower abdominal pain. Bleeding is excessive, the pulse is weak and thready, and the tongue is pale with a thin coating. Treatment. The first group of points are Qi Hai, Ren 6, Zhu Sanli, stomach 36, and Yin Bai, spleen 1. The second prescription includes Bai Hui, Du 20, which can promote Yang Qi, Guan Yuan, Ren 4, and Pishu, bladder 20. These 2 prescriptions are applied alternately to invigorate the qi and stop the bleeding. Needle Qi Hai, Ren 6, with the reinforcing and twisting method. Retain the needle. Needle Zhu Sanli, stomach 36, at a 15-degree angle and retain the needle. Moxibustion is applied to Yin Bai, spleen 1, for 15 minutes. In the second group, needle Bai Hui, Du 20, with Moxibustion for 10 minutes. Needle Pishu, bladder 20, with the reinforcing and twisting method for half a minute. Needle Guan Yuan, Ren 4, with the reinforcing and twisting method. Again, retain the needle. 2. Menorrhagia due to blood heat. The patient suffers from metrorrhagia with bright red blood and a thick odorous discharge, which is a result of wine drinking. The patient feels uneasy, dry, and dizzy. The pulse is wiry and rapid, and the tongue is red with a thin yellow coating. Treatment. The first prescription includes Qi Hai, Ren 6, Tai Chong, liver 3, and Yin Bai, spleen 1. The second group of points are Guan Yuan, Ren 4, Tai Xi, kidney 3, and Rangu, kidney 2. Needle these points alternately to clear heat and cool the blood. The first group, needle Qi Hai, Ren 6, and Tai Chong, liver 3, with the twisting and reducing method by lifting and thrusting for half a minute. Then retain the needles. Moxibustion should be applied to Yin Bai, spleen 1. Apply the second group 1 day later. Needle Guan Yuan, Ren 4, with the reducing, lifting, thrusting method, and retain the needle. Needle Tai Xi, kidney 3, at a 15-degree angle, and Rangu, kidney 2, with the reinforcing method. All the needles above are retained for 30 minutes. For patients with blood stasis, Hagu, large intestine 4, is needled at a 15-degree angle. Needle Sanyin spleen 6, making an upward sensation. On the basis of the second prescription, Siliao bladder 32 is needled with a twisting and reinforcing method by lifting and thrusting. Do not retain the needles. Needle Xuehai spleen 10. For those suffering from metrorrhagia, excessive bleeding with the treatment should be given 2 to 3 times a day. For patients with dripping blood, the treatment is given once a day. After the bleeding stops, the treatment is given once every other day. 3 extra treatments are needed to consolidate the effect. When metrorrhagia occurs, the first step is to stop the bleeding and take medication if necessary. It is advised to avoid eating pungent food and drinking alcohol. When blood dripping occurs, it is advised to have a good rest and no sexual activity. Malposition of the fetus. Occipito anterior is the normal fetal position. Breaches of the occipito posterior position and transverses after 30 weeks are regarded as abnormal. Correcting the position with acupuncture is appropriate between 29 and 38 weeks of pregnancy. Treatment. Needle Zhejiang bladder 67, which is the Jing well point of the bladder meridian of the foot Taiyang, and it can nourish the kidney and regulate the qi to correct the fetal position. The patient is required to urinate and loosen the belt before the treatment. Moxibustion is applied for 20 minutes. The patient may also receive laser therapy. The treatment is given once or twice a day. 3 to 5 days are one course of the treatment. If the malposition of the fetus hasn't been corrected, an extra course of the treatment is needed. If there is still no effect, try another treatment. It is normal for the fetus to move more and the heartbeat to accelerate after acupuncture. Acupuncture is not recommended for those with habitual miscarriage or toxemia. Lack of lactation. The puerpera fails to supply enough milk for her child because of her deficiency of qi in blood or stagnation in the milk meridian. Treatment. The main points are Danzhong, Ren 17, which is the center of qi, Rugen, stomach 18, the stomach point of the foot Yangming, and Shaozi, small intestine 1, which is the Jing well point of the small intestine meridian of the hand Taiyang. To puncture these points can promote lactation by nourishing the blood. Needle Danzhong, Ren 17, then lift the needle and insert into the right and left breasts in a horizontal direction with the twisting and reinforcing method by lifting and thrusting for a half minute. Then insert the needle downward and retain. Insert a short needle into Rugen, stomach 18, upward, about 0.5 centimeters deep. Do not retain the needle. Apply Moxibustion at the above-mentioned points to warm the needles. Needle Shaozi, small intestine 1, with quick insertion. The treatment is given once or twice a day for 3 to 5 days to make one course. The prescription has better effect on young women with fewer births, normal breasts, and no obvious deficiency of qi and blood. Pay attention to nutrition and eat more soup. Feed the baby regularly and have sufficient rest and maintain good spirits. Infertility. The infertility of a childbearing aged woman who has lived together with a healthy spouse for 3 years is called primary infertility. Infertility of 3 or more years after a previous pregnancy is called secondary infertility. The acupuncture treatment should be based on the exclusion of the following cases: hypogenitalism, abnormalities and organic diseases of the genitals, ovarian endocrine dysfunction, and chronic consumptive diseases. Clinically, it is divided into 5 types. Puncture the following 2 groups of points alternately. First, the main points, Guanyuan, Ren 4, Zigong, extra point, which is the extra point for the uterus used for the treatment of infertility, and Sanyinjiao, spleen 6. And then, Zihu, extra point, and Baomen, extra point, which are the extraordinary and empirical points for treating infertility. Dahe, kidney 12, which is the meeting point of the Chong and kidney meridian, and Xuehai, spleen 10, the point of the spleen meridian. The alternative needling of these 2 groups of points can warm and recuperate the extraordinary meridian and regulate the Chong and Ren meridians. The patient is weak. After 3 years of marriage, her menses are always late with light scanty blood discharges, a deep and thready pulse, and a pale tongue with a thin coating. Puncture the first group of the main points in combination with Ganshu, bladder 18, and Zusanli, stomach 36. In addition, for the second group of points, add Shenshu, bladder 23, and Jiaohai, kidney 6, to invigorate the qi and nourish the blood. Needle Ganshu, bladder 18 first, with a twisting method for half a minute. Then withdraw the needle. Needle Guanyuan, Ren 4, and Zigong, extra point, with a twisting and reinforcing method. Combine treatment with Moxibustion using moxicones. Puncture Zusanli, stomach 36, and Sanyinjiao, spleen 6, at a 15-degree angle, and retain the needles for 20 minutes. Needle the second group of points the next day. Needle Shenshu, bladder 23, with the twisting method. Do not retain the needle. Needle Baomen, extra point, and Zihu, extra point, with a twisting and reinforcing method. Moxibustion using 2 cones of moxa is applied. Needle Xuehai, spleen 10, and Jiaohai, kidney 6, with the reinforcing method, and retain the needles for 20 minutes. 2. Infertility due to deficiency of the kidney is always accompanied by irregular menstruation, scanty and light-colored blood, excessive leukorrhea, weak loins, dizziness, tinnitus, cervicitis, a deep pulse, and a thin coating on the tongue. Needle the 2 groups of the main points mentioned above in combination with Shenshu, bladder 23, Diji, spleen 8, and Jiaohai, kidney 6, with the reinforcing method to nourish the kidney and strengthen the essence. Needle Shenshu, bladder 23, but do not retain the needle. Needle Diji, spleen 8, and Jiaohai, kidney 6, and retain the needles for 20 minutes. 3. Stagnation of phlegm. The patient has failed to have children after 6 years of marriage. Her menses have become scantier in amount and lighter in color, while her weight has increased. The pulse is wiry and the tongue is thin with a white coating. Puncture the first group of the main points, Zhongji, Ren 3, and Fenglong, stomach 40. The second group of Pishu, bladder 20, and Yinlingquan, spleen 9, to invigorate the spleen and eliminate phlegm. Needle Guanyuan, Ren 4, and Zhongji, Ren 3, at a 15-degree angle. Moxibustion with 2 cones of moxa is applied. Puncture Fenglong, stomach 40, with the reducing method, and retain the needles for 20 minutes. Needle the second group of points on the next visit. Puncture Pishu, bladder 20, with the twisting method for half a minute, and withdraw the needle. Insert Xuehai, spleen 10, and Yinlingquan, spleen 9, with the reducing method by lifting and thrusting, and retain the needles for 20 minutes. 4. Cold evil in the uterus. The patient has scanty and dark blood in the latter part of the menstruation period, a feeling of cold pain in the lower abdomen, weak loins and cold limbs, a deep pulse, and a pale tongue with a thin and white coating. Puncture the first group of the main points mentioned above in combination with the extra points Mingmen, do 4, Shenshu, bladder 23, and Zusanli, stomach 36. Treat the second group of the main points mentioned above together with the extra point Shenque, Ren 8. The alternative puncture of these two groups of points can expel the cold by warming the uterus. Puncture Mingmen, do 4, and Shenshu, bladder 23, with the reinforcing method and retain the needles for half a minute, and then apply Moxibustion for 5 minutes. Needle Zusanli, stomach 36, and apply warm Moxibustion at Shenque, Ren 8. 5. This patient has borne no child after 4 years of marriage. There are clots in her menses accompanied by distending pain in the lower abdomen and breasts. Her pulse is wiry and the tongue has a thin coating. Puncture the first group of the main points mentioned above in combination with Hegu, large intestine 4, and Taichung, liver 3. Combine the second group of the main points mentioned above with Siliao, bladder 32, and Zusanli, stomach 36. The alternative needling of these two groups of points can regulate qi and dissipate blood stasis. Needle Hegu, large intestine 4, at a 15-degree angle. Insert Taichung, liver 3, with the twisting and reducing method and retain the needles for 20 minutes. Needle Ziliao, bladder 32, with a twisting and reducing method for 30 seconds. Then withdraw the needle. Then needle Zusanli, stomach 36, with the twirling reducing method and retain the needle for 20 minutes. The treatment is given once every other day. 10 treatments constitute one course of the treatment. 5 days later, the second course begins. Stop acupuncture during the period of menstruation. After 2 courses are completed, it is altered to give 5 times of the respective treatment before and after the menses. During the treatment, attention should be paid to indications of ovulation and copulation. Avoid excessive sexual activity. Chinese medical herbs may prove necessary for a successful treatment. Pediatric diseases. Enuresis. Enuresis means bedwetting by children aged over 3 years old. It occurs several times at night for some children. The patient's kidney qi becomes deficient due to continued enuresis. Some patients may become thin, depressed, and jaundiced. Treatment. 2 groups of the main points are used for the treatment. The first group are Shenshu, bladder 23, Guanyuan, Ren 4, and Sanyinjiao, spleen 6. The second group is Hangguanshu, bladder 28, Zhongji, Ren 3, and Dadun, liver 1. Alternately apply these 2 groups of points each day to nourish the kidney qi and strengthen the organ's function by reinforcing the primordial qi. The patient is required to discharge urine before receiving the treatment. In prone posture, needle Shenshu, bladder 23, on both sides with the twisting and reinforcing method. Withdraw the needle after the patient receives the qi. Press on the point to nourish the kidney qi. Then needle Pangguanshu, bladder 28, on both sides, as was done with Shenshu, bladder 23. In supine posture, slowly and perpendicularly insert the needle into Guanyuan Ren 4. After the patient receives the qi, manipulate the needles continuously so as to spread the qi to the perineum. Do not retain the needles. Needle Zhongji Ren 3 in the same method as Guanyuan Ren 4. Needling these 2 points can nourish the kidney qi. Needle Sanyinjiao spleen 6 with the twisting and reinforcing method. Retain the needle for 5 minutes after the patient feels the qi. This is to regulate the liver, spleen, and kidney qi and strengthen the bladder function. Moxibustion can be applied for patients with yang deficiency. Apply Moxibustion at Guanyuan Ren 4 for 10 minutes. This achieves therapeutic effect by invigorating primordial yang and strengthening the qi. Add Shenmen Heart 7 for urination during sleep. Add Pishu Bladder 20 and Zusanli Stomach 36 for those with poor appetite. During the treatment, parents should strictly control their children's intake of water at dinner and before sleep. Discharge urine regularly before sleep, and plenty of outdoor activities are encouraged. Acupuncture treatment can achieve very good therapeutic effects on enuresis. For enuresis caused by organic diseases such as deformity of the urinary tract, latent spina bifida, and oxyuriasis, the primary disease should be treated first. Infantile malnutrition. Infantile malnutrition is a symptom caused by insufficient feeding, nutritional imbalance, and food preferences. Thus, the stomach and spleen are damaged. Treatment: puncture Pishu Bladder 20, Weishu Bladder 21, Xiawan Ren 10, Zusanli Stomach 36, Shangqiu Spleen 5, and Sifeng Extra Point in order to regulate and nourish the spleen and stomach and relieve dyspepsia. In prone posture, needle Pishu Bladder 20 and Weishu Bladder 21, 0.5 cun. After the patient receives the qi, twist the needle slightly with the reinforcing method. Press on it when you take the needle out. Do not retain the needles. Needle Weishu Bladder 21 in the same method as Pishu Bladder 20. Needle these 2 points in turn to strengthen the stomach and spleen, reinforce the middle warmer, and promote qi circulation. In the supine posture, needle perpendicularly at Xiawan Ren 10 at a 0.5 cun depth. After the patient gets the qi, apply the reinforcing method by the breath or by shaking without retention of the needle. The function is to regulate the qi of the stomach and to promote digestion. Puncture Zusanli Stomach 36 with a slight lifting, thrusting, twisting, and shaking method. Do not retain the needle. Needle Sifeng Extra Point with quick insertion. After local sterilization, squeeze the finger with the left hand and needle Sifeng Extra Point with the quick insertion by the right hand. Squeeze the finger until a little blood comes out. This method is helpful to strengthen the bone and improve digestion. The treatment of the quick insertion method is given once every other week. 3 times are enough to have effect. Needle Shangqiu Spleen 5, which is the point of the spleen and can improve digestion. The treatment is given once every other day. 10 treatments constitute 1 course of the treatment. Take a 1-week break before the next course begins. During the treatment, it is advised to eat regularly and avoid too much sweet, fatty, or cold food. Have plenty of outdoor activities to improve health conditions. If the disease is caused by intestinal parasites, chronic diarrhea, or tuberculosis, the primary disease should be treated first. Sequelae of poliomyelitis. Sequelae of poliomyelitis is acroparalysis caused by an infection of poliovirus. In the early stages, acupuncture can achieve good results on the recovery of the function of the limbs and the correction of skeletal deformities. This disease usually affects the forelimbs, particularly the lower limbs. 1. Paralysis of the lower limbs. Puncture Biguan, stomach 31, Futu, stomach 32, Zhusanli, stomach 36, and Jiexi, stomach 41, as the main points on the affected limbs. By filiform needles, quick insertion with the reinforcing method is applied at these points from the upper to the lower along the meridian of the foot Yangming, without retaining the needles, in order to smooth the Yangming meridian's qi and nourish the affected limbs. Two, back knee. The points to needle are Yao Jiaji, extra point, Chengfu, bladder 36, Weizhong, bladder 40, and Chengshan, bladder 57, in addition to the main points. Puncture Jiaji, extra point, 0.5 cun deep with a 32 gauge needle against the spine at an angle. Twist it after qi is obtained and then withdraw. This method can regulate the function of the internal organs and smoothen qi and the lower limbs. Needle Chengfu, bladder 36, perpendicularly 2.5 centimeters deep. Twist the needle and withdraw as soon as the qi is obtained. Needle Weizhong, bladder 40, and Chengshan, bladder 57, with quick insertion. All these points are associated with dredging of the bladder meridian. 3. Pes equinovarus. The main points needled are Yanglingquan, gallbladder 34, Feiyang, bladder 58, Xuanzhong, gallbladder 39, and Qiushu, gallbladder 40. For long-term paralysis patients, the twisting and reinforcing method should be applied, retaining the needle after the patient feels the qi. Xuanzhong, gallbladder 39, the gathering point of myeloid, is needled so as to nourish the tendon and bone. Needle Qiushu, gallbladder 40, 0.3 centimeters deep against Jiaohai, kidney 6. Needling Feiyang, bladder 58, can correct the symptoms of Pes equinovarus. 4. Paralysis of the upper limbs. Locate Tianzhu, bladder 10, Dazui, du 14, Jianyu, large intestine 15, Chuchu, large intestine 11, and Hegu, large intestine 4, of the affected side as the main points. The patient is required to bend his head slightly and insert Tianzhu, bladder 10, 0.3 cun deep. Take it out after the patient feels the qi. Needle Dazui, du 14, which is the meeting point of the yang meridian, and can promote and regulate qi of the 3 yang meridians in the upper limbs. Needle separately Jianyu, large intestine 15, Chuchu, large intestine 11, and Hegu, large intestine 4, with quick insertion to smoothen the qi of the Yangming meridian and regulate the circulation of qi and blood. 5. Difficulty in raising the arms. In addition to the main points, needle Tianzong, small intestine 11, and Binao, large intestine 14, on the affected side, 0.3 cun deep with quick insertion to smooth and activate the meridians. Do not retain the needles. 6. Dropped wrist. Needle 4堵, 三角 9, and 外观三角 5 in addition to the main points. Needle 4堵, 三角 9, and 外观三角 5 on the affected side perpendicularly. Retain the needles for 20 minutes after the patient feels the qi. This is to stimulate qi of the Zhejiang meridian. The treatment is given once every other day. 12 treatments constitute one course of the treatment. A 1-week break is to be taken before the second course begins. During the treatment, parents should cooperate with the doctors by helping their children do some passive exercises in order to help correct the deformity and achieve better results.
一路漫漫，披荆相伴，